Welcome everyone. This video tutorial is to guide you through the process of your immigration medical exam so that you can ace it in one go. If you are watching this video, you have already taken the first step of visiting our website askforcure.com. You can book your immigration medical exam online through this website. Before you show up for your appointment, there are a few things that you will need to do so that you can get your sealed envelope on the same day as fast as possible. Here we will guide you through the complete process from booking your appointment to preparing your documents including lab tests and vaccinations prior to your appointment. Once you are on our webpage, we recommend visiting our frequently asked questions section by clicking FAQs on the left side menu. Here you can find answers to most common questions that most people have. The cost of the immigration medical exam and completing the I-693 form is $180 per person. This fee does not include any lab tests or imaging or treatment. Once you have booked your appointment, you need to make a note of things to bring to your appointment. These include a government-issued valid photo ID such as driver's license or a state ID or your passport, your I-693 form for each applicant. You can click the link on our website which will take you to the newest version of I-693 form from USCIS website. Once you have opened this link, we recommend that you save this form to your computer by clicking the save icon on the top right corner of your browser as shown here. After saving this form, open it with a PDF reader software to fill it out. It's best not to use your internet browser to fill this form. Once you have opened this form in your PDF reader, fill the first page of the form with your name, address, and other relevant details in the respective assigned fields. Please make sure all the details are correct. Some people will also have an A number that they can find on their EAD card as shown here in the red demarcated area. Fill this number on the I-693 form in the designated space. Most people do not need to fill out the USCIS online account number and can leave the section 3F and 4A blank. Now scroll down to page 2, you will notice that the top of each page is automatically filled. You will need to click on the A number field here once for it to auto-populate. Now fill out your desired phone number and email in the respective field. That's it, you do not need to fill out anything on this form unless you are using an interpreter. Now go ahead and print the filled out I-693 form with your printer. We recommend that you do not print on both sides of the paper, rather use single-side printing. Next, you will need to gather the vaccination records and lab tests as needed, to upload them using the link provided on our FAQ page as shown here. When you click the link, it will take you to a web form. Here, fill out all the required fields and select your age group as appropriate. This will bring up the list of all required documents. Here, we are using an example of a 30-year-old person. This person will need to upload the lab test results of TB and syphilis. The influenza vaccine is only needed during flu season, which is typically from September to May every year. For vaccines of MMR, hepatitis B and varicella, either a blood test for immunity or a vaccination record will suffice. COVID-19 vaccination record is needed for everyone. Once you have finished uploading, you can click Submit. Please make sure you sign and fill out your identification details as appropriate. Once you have submitted your documents, we will review them and contact you via email in regards to any required lab tests and/or vaccines that you will need for completing your I-693 exam. When you visit our website to book your immigration medical exam, navigate to the I-693 page on our website to see the list of required tests and vaccines and how to get them done prior to your appointment. Here you can select your appropriate age group to see the details relevant to you. The USCIS Immigration Medical Exam typically needs some lab tests and immunization records. The lab tests include a blood test for tuberculosis, which is referred to as quantiferon TB gold test, a blood test for syphilis which can be RPR or treponema antibody test, and a urine test for gonorrhea. Please note that not everybody needs these tests. Here we have provided the age group of the applicants for whom these tests are appropriate. Tuberculosis blood test, which is quantiferon TB gold test, is needed for everybody aged 2 years or above. Syphilis blood test is needed for all applicants in the age group 18 to 44 years. Gonorrhea urine test is needed only for applicants in the age group 18 to 24 years. As you notice, it is safe to assume that most of the applicants will need tuberculosis blood test, which is quantiferon TB gold test. A skin test for tuberculosis is not acceptable to USCIS, only blood test mentioned above is accepted for this exam. The vaccinations needed for each individual vary by age group. Here we have provided lists specific to age groups so that everybody can find the accurate list for their particular age. One note about the influenza vaccine and COVID-19 vaccine. Influenza vaccine is needed only during the flu season, which is typically from September to May each season. COVID-19 vaccine is typically required for everybody as per CDC guidelines. We want to reiterate, COVID-19 vaccine completion is a must requirement for every applicant unless they are willing to file a separate waiver to USCIS for seeking an exemption to COVID-19 vaccine or any other vaccine, which is a very time-consuming process. Hence, we recommend the completion of vaccines prior to your appointment. For some vaccines which will be mentioned below, they are administered as 2 or 3 doses for completion. However, for the immigration medical exam purposes, as long as you have had first dose of the vaccine and it's not time for the subsequent dose prior to your appointment, the immigration medical exam can be completed with just the first dose. However, we recommend that after your immigration medical exam you should complete the vaccination series. In this video, we are going to discuss all the vaccines that apply to adult applicants, which is applicants 18 or above. You can still find the list of vaccinations for all other ages on our I-693 page and Frequently Asked Questions, FAQ, page. We have provided the links of each vaccine where you will find comparative prices from different pharmacies based on your zip code. You can shop at your own convenience. You can get all these vaccines on same day unless you are allergic to any particular vaccine on the list. The first on the list is Tdap, that is tetanus vaccine, which is required once every 10 years for most adults. If you have a record of receiving this vaccination within the last 10 years, you do not need to get another shot unless advised by your doctor. If you do not have any record for immunization in the last 10 years for tetanus, you will need to get a booster dose of tetanus vaccine, which is Tdap vaccine or TD vaccine, at your nearby pharmacy prior to your appointment. Next, this COVID-19 vaccine, which, as we mentioned, is needed for everybody, can be obtained at any nearby pharmacy, and you must have records of completion for this vaccine as well. Next vaccine on the list is varicella vaccine. This is a chicken pox vaccine and is not the same thing as shingles vaccine. This vaccine is given as a 2-dose. Next vaccine is MMR vaccine, which is immunization against measles, mumps, rubella. This vaccination is required for anybody born after 1957. If you had MMR vaccine in the past, you can bring those records. If you do not have records for vaccination, you can either opt for blood test for immunity, or you can opt to obtain a single dose of MMR vaccine, which will be enough for completion for all adult applicants. Another vaccine needed for people in the age group of 18 to 59 years of age is hepatitis B vaccine, which is a typically 2 or 3 dose vaccine. Again, if it is not 5 time for the subsequent dose, first dose is enough for completion of immigration medical exam. If you are confident that you have received hepatitis B vaccine in the past, you can always opt for the test of immunity to show that you are immune to hepatitis B. Another vaccine that is needed for people 65 years of age or more is pneumonia vaccine, which is a single-dose vaccine if administered as Prevnar 20. At this point, test of immunity is not acceptable for proving vaccination. You must have a record of vaccination for this vaccine, like Tdap, flu, COVID-19. For completion, remember that flu vaccine is needed for everybody only during flu season as mentioned above, not during the rest of the year. Thanks for your patience and watching so far. The hardest part is done. Now you can book your appointment by going to Appointments page on the left side menu. Here you can select the desired location of your appointment. Once you select a location, you will see options of dates available. You can also text the number shown on right side for any additional dates or times to check for additional availability. Once you have finalized your date, click on it, see available time slots, and proceed on to click the Book button to go to Checkout section. Please make sure your details are filled out accurately. You can book additional appointments for your family members by clicking Book More Services button. Hopefully this has helped you understand the process of I-693 exam. Thank you for watching this video, and we hope to see you soon in person.